Those data run in arrears. We could be closer to 200 million people who have already had it.
Do you think there's any reason for someone who's already had COVID to get vaccinated?
No, there's 3 studies well characterized, and 3 more that have weighed in preprint showing harm. So we've already covered the fact that recovered people don't get COVID a second time. And even if you argue that you think you can find a case here and there, boy, it's 1 in 7 billion people who can get COVID a second time. It's rare as hen's teeth if it even happens. So the point is, if you can't get it a second time, you can only be exposed to harms. So the vaccines, like any other medical treatment, are not free of adverse effects.
Now, what if someone got a very mild case of COVID, an asymptomatic test that showed up, or asymptomatic case that showed up as a PCR test, especially when they were running, 40 cycles at one point in time? If that person tested positive on multiple occasions but does not show antibodies in an antibody test, do you think for that person it would be a good idea to get vaccinated?
There's 3 ways to prove your immunity. One is you have a concrete case of COVID-19. So you have the characteristics, signs, and symptoms. You were sick, positive PCR test, preferably low cycle threshold, antigen test. I got COVID-19. I did the right thing. I was in FDA-approved research. I took hydroxychloroquine in FDA-approved research, and I tested positive for the PCR, but also the antigen. So I had, COVID-19 is such an important diagnosis. Why don't we confirm it? In HIV, we always use confirmatory testing. We don't ride on one test alone. But in the case where it's well documented and you're sick, you're done. You basically have permanent immunity at that point in time. 135 studies support that now. Paul Alexander.
Permanent immunity.
Permanent. SARS-CoV-1, which is 90% similar to SARS-CoV-2, it's forever.
So
it's forever.
If you have symptoms and you recover from those symptoms, likely you have lifetime immunity.
Everything we can tell, it's just like SARS-CoV-1. SARS-CoV-1 is 17 years old. It's one and done, supported by 135 studies. And this recent CDC, the CDC is a stakeholder in the vaccine program. They're running it with the FDA.
They are?
They are. The CDC and FDA are the sponsors of the U.S. vaccine program. And they've been telling people recovered that they should take the vaccine because they could have it again. And that's the reason why when they were pressed to say, listen, find a case of someone who really had COVID-19 a second time, they couldn't find a case. That was the most revealing news that came out of the CDC in weeks, and it was great news for America.
So you think that recommendation is not based on science. It's based on the idea that they want to distribute as many vaccines as possible.
Well, it was based originally out of a concern of caution. Don't forget the vaccine recommendations.
Originally.
Yeah, originally. So listen, we're not sure if you can get it again. Take the vaccine, right? So they were just general. Remember, the vaccines originally were just offered, as they should. They're research. The vaccines are research. They are all investigational research, and so nobody can encourage somebody to take a vaccine, by the way. That violates the Nuremberg Code. Can't do it. Research is neutral. As a doctor, I can never tell somebody they should take the COVID-19 vaccine. Why? Because same reason why I can't tell them, say, listen, you should be in my research study. You should take my research pill for diabetes. You know, if I told them that, you should be in my research study, I'd be sanctioned by the IRB. I'd be called by the FDA. That's out of bounds. We never give any pressure, coercion, or threat of reprisal for participating in research. Violates the Nuremberg Code. And we certainly wouldn't do it with these vaccines because we don't have all the data yet.
But yet so many people are doing that.
Well, I tell you right now, they're walking a line on bioethics that they will be held accountable. You can't do that. You can't do that. No one can. No good doctor can. No good doctor. Now, getting back to vaccine safety. So the idea here is that we have to reconcile with vaccine safety. So the story is by January 22nd, we already had 182 deaths after the vaccine. January 22nd. For all the vaccines combined, 278 million shots given each year in the United States. Kids, adults, me and you. I took 2 last year. I took 1 this year. 270 million shots. The average number of deaths that would ever come into our central database, about 150. We've been keeping this database for 20 years. Suddenly, we were at 182. And then it was a very important recognition that many of us had. Say, wait a minute. The CDC and FDA, they didn't have any safety review. They didn't have an external critical event committee. They didn't have a data safety monitoring committee, and they didn't have a human ethics board assigned to the program. It turns out we had the wrong agencies leading the program. The FDA is supposed to be the drug watch government organization. They don't lead clinical programs. The CDC is supposed to be the outbreak evaluation program. They don't lead clinical programs. So, in fact, we actually had the wrong, in a sense, the fox guarding the chicken coop, in a sense. We had the wrong people leading the programs, and then we didn't have the independent safety committees. So there was nobody to stop the program in February. Normally what happens is you get 5 deaths after any product is unexplained. Black box warning, may cause death. You get to 50 deaths, I don't care if it's 50 million, 60 million people take the drug, you get to 50 deaths, it's off the market, and it gets reviewed for safety. I've been involved with these, Joe, at a national level. We never let a drug go on and be associated with 50 deaths afterwards. We were at 182, and there was no safety review. Remember, I told you in February, I demanded, as a citizen, a report from the federal government. We needed a report and a press briefing